Laura Cruz-Acosta, the spokesperson for the city of El Paso, specifically the strategic communications director. So I wanted to go over for you very quickly in terms of the process that we go through or that an individual would go through in order to get registered for the COVID vaccine. So assuming you're on the website, and we're looking at the website right now. So assuming you're on the website, and that's epcovidvaccine.com, you'll see up here, we have the pre-registration here, but we encourage folks to scroll down a little bit just to make sure that they follow the steps. So step one is you make sure that you're eligible. Right now, we are in phase one, specifically in looking at groups 1A and 1B. And so we have the qualifications listed there for 1A and 1B. And then you go on to step two, which is to qualify, if you, assuming that you qualify for 1A and 1B, then you go ahead and pre-register. We want to remind folks, if they've already pre-registered and they've got a confirmation page, then they don't necessarily need to pre-register again. Now we understand that there's some folks who have been registered since December, early January, and they haven't received a call for registration. So we ask those folks to go ahead and reach out to us through our COVID hotline, which is 21-COVID or 212-6843. So if you haven't received that if you haven't received a call from us, just go ahead and come call us and check with us. So on the next step, you obviously pre-register, and we'll go through that real quick right now. Step three is going to be to continue to wait and check your email and phone number. Now we have reports that sometimes the confirmation emails go to the junk or the spam email boxes. So be sure to check those boxes. We have the capability, one of the improvements that we've made is for the to receive a text message advising them that they've registered. So that's a good thing. And then when you get vaccinated, completely vaccinated, one of the things that we urge the folks to continue to remember, the vaccine is not a cure, and the vaccine does not protect necessarily everybody that you come into contact, because you might still have gotten COVID, but the impact because of the vaccine has now been reduced in your own self. Not everybody's received the vaccine, so those are the individuals we want to be watching out for and caring for. So moving on to the website, assuming that you've now looked at everything that we have on this website, you can actually pre-register. And we do have it in Spanish. So when you click on the Spanish version, you also get the information in Spanish. My email automatically changes it, or my website automatically changes back to English because it's the primary language. So if that's your primary language, it'll switch it back. So make sure that if you want it in Spanish, click it back to Spanish. So assuming that we are going to go in English, so we go ahead and pre-register. And the pre-register pops up and it gives you an idea of what you're walking into. It gives you an idea, okay, you're gonna need the demographic details, the medical history, the history of COVID in your family or in yourself, and then contact information. So we're going to go ahead and proceed. And it reminds us, you please don't register more than once. And we've had some folks actually register and they multiple times, and maybe they use a different name. They use their middle name or middle initial, and that actually does impact the vaccination process. So we urge folks, please just register once. And if you have any trouble, please reach out to us. Then when you click on it, we have the disclaimer, obviously. We're asking the folks to follow this application process and to be patient with us. The process is dictated in part by the state and the federal government. So there's certain questions that we ask based on what we're required of the state and of the federal government. So we go through this and explain it again, the phases. So we're going to generate the code here. We have addressed some of the concerns that we have here in terms of the Spanish and the AD accessibility components. So those have all been addressed with some by our staff. So I'm going to go ahead and enter here myself what it is that we are doing. I'm going to enter the code. And it goes on to the next page. So it asks you a series of questions. First question is if I'm a responder of some kind. So obviously, I'm not one of those first responders. If I'm a resident or staff member that works in the hospitals for long-term care facilities, hospices, and home health agencies, or if I'm involved at any point with COVID patients, I'm not. So I click no. If I'm a member of the public health or emergency response team, those individuals who are actually going out and administering the testing or the vaccination, I do not. So I'm going to click no, obviously. If I'm a staff member working out for outpatient care services, such as the care clinics or laboratories or the pharmacies, again, the answer is no for me. I'm a last responder providing mortuary services, such as funeral home services. Those individuals are also at high risk. So we ask that question. I'm not one of those. So I say no. If I'm a school nurse providing healthcare, I'm no. If I'm a healthcare or frontline essential worker that's directly involved with patients, while I might actually be considered an essential worker that's involved in the COVID-19 efforts, I'm not at high risk in terms of in this regard. So I'm going to click no. But you will notice that there's some educators out there that actually are issuing out the vaccine not the vaccine rather, but the testing. So they might click yes here. If I'm at increased risks for severe illnesses, such as a virus that causes COVID-19. Now I'm going to assume that I'm going to say yes here. If I have diabetes, I personally do not have diabetes, but let's say I do. So I'm going to click yes in terms of that so that we can go through the process. So, and then are you a healthcare professional such as a dentist or nurse assistant, for example, that sees patients? No, I'm not. Am I 16 years of age or older? Yes, I have a chronic illness, let's say. I have diabetes. Oh no, I'm sorry. I'm gonna go back and click no on this one. I misread it. I thought it was this one. So I'm not at increased risk, but I am over the age of 16. And so let's say that I have diabetes. So I click yes in that section. And are you over 65 years of age and older? So I'm not, but let's say that I am. So for processing purposes and to show you all what it is, let's say I am over the age of 65 and I also have diabetes, for example. So we click on the next button and it'll process through to the next set of questions. Here, you click on whether or not you fit into what race. So for example, I'm white technically, and I am Hispanic. So, but I'm gonna click it down here. I don't have any other race necessarily, but we do offer the other. For example, let's say that there is some other race that I identify with. So I would click other and then list the race here. If I'm a member of the tribal community, I'm not. And then if I have any allergies for the vaccine. So you look at the ingredients of the vaccine. So we provide the ingredients here in terms of the vaccine information. And you can look at it to see particularly if you're have an allergy in that respect. If I'm pregnant, so I'm not, but you can also click yes or suspected. So whichever one you think that you might fit into the category. And then we have a check that apply if I have. So let's say that I have diabetes, for example, we talked about that one. So I click the diabetes. And then you can click any other categories that you have in terms of other conditions that you might have. We do, if none of them are listed that you might have that illness, we do list the other pre-existing conditions, so you can click on that one. And then of course you click next. In the next one, we're going to ask you about your testing and COVID experience in your history. So if you've tested for COVID in the past, I have not. Have you had a COVID test in the last 10 days? I have not. Is the patient under isolation? I'm not. Is the patient, is the physician or medical provider indicated that you should not receive this vaccine? Now, there are some cases in which maybe your doctor might say you really shouldn't get the vaccine for whatever reason. Your medical provider might ask you about that. And if this is a first COVID vaccine dose, so this is my first COVID vaccine dose. So I'm going to say yes. Next. And then I'm going to fill out all of this information. This is probably the most critical information that you have to fill out, and you have to fill out carefully. And then we do ask if it's a home phone number or if it's a cell phone number, because if it's a cell phone number, we can send you a text message. If it's a home phone number, we obviously have to call you. And then the gender, so I'm a female. And then we'll put in my date of birth. I'm going to just put January the 1st. I'm going to be a New Year's Eve baby. And I'm going to put 1999 because I like to party. And so in here, we're also going to put in insurance. Now, this has been a question. There's no cost to the vaccine. If they're insured, we do ask for the insurance so that the city can be reimbursed at no cost for the cost of the vaccine through the insurance, but it is not a requirement. So I'm going to put no insurance. And then, so I leave all of this blank. If you have no insurance, if you do not have insurance, we do ask that you help us out to seek the reimbursement through the health resource, the HRSA, which is the Health Resource and Services Administration. But again, this is just required in order for us to get the information. You do not need to fill it out. If you do not have insurance or social security number or driver's license, you can proceed without having filled that out. So I'm gonna go ahead and leave it blank since I have no insurance and I don't have any of this. Let's say I don't. So I'm gonna go on to the next page. And then we're almost done. So I fill out the first responders. This is where I'm gonna verify all the information that I have. And I go through it and we urge folks, please, please, please make sure you fill that out completely. And fill it out closely as possible. Make sure that it's correct. All of the information is correct. And I'm gonna put in here while we're going through this. So let's say that I find an error here in my name. So I'm gonna say, okay, there's an error there in my name. And so I wanna go back real quick because what I wanna do here is if I wanna put test don't add. I'm going to put testing Laura. Testing Cruzacosta. Okay. I'm going to add that through. And you'll see the change here. So it's testing Laura, testing Cruzacosta, because I'm going to actually submit this and I don't want staff to review the information. So testing has been added. And so I verify that the information is accurate as to my knowledge. So again, really closely look at all this information that you're about to submit. And then click next. So it says, thanks for registering. Be sure to check your junk mail and then stay up to date. And so I'll then go and look at my actual work email to make sure that it's there. So it's loading into there. And I don't know if you can see that screen either, but I haven't received it yet, but it should be getting here pretty soon. There it is. So then I'll get an email that looks like this. And then I know that I've been registered.